Good afternoon. Welcome to our Wednesday COVID-19 briefing, where we talk about and share information with you about the many ways that we are attempting to mitigate the spread of this virus and to restart our economy here in this state and keep our citizens safe at the same time. Today I want to talk about the considerations that we are taking into account as we work toward a phased reopening of Tennessee's economy. I also want to cover the Unified Command Group's work to ensure vulnerable populations, especially in our long-term care facilities, remain as safe as possible throughout this pandemic. Today, our case count stands at 7,842 confirmed cases in our state. We have lost 166 Tennesseans to COVID-19. 4,012 have recovered, and we have tested 114,980 Tennesseans. As we think about reopening our economy and monitoring the results of that, I want to talk a little bit today about the data that we're looking at to inform our decisions now, and the data that we'll be looking at to determine how well social distancing is working as we move into phase one of reopening the economy. Virtually every indicator of success in containing COVID-19 shows that your efforts have been working. This isn't an indication that we can slack off at all, but it does give us a path to move toward doing some of the things that we did before, but in a new way that will incorporate social distancing in our daily lives. The federal guidance for phased reopening has largely informed our path moving forward. In the White House guidelines for opening up America again, there are 3 buckets of data that are called out. These 3 buckets are symptoms, cases, and hospitalization. There's also some additional data points that we're tracking, and I want to talk about those as well. First, symptoms. This is probably the one that we've talked least about, but it's very important. We're looking for a downward trajectory of flu-like symptoms and COVID-like symptoms in our emergency departments across the state. For the past 3 weeks, both flu-like symptoms and COVID symptoms have steadily declined within the vast majority of our hospitals, meaning that we're hitting this important benchmark. The second point is case data. According to the federal guidelines, we're looking for a downward trajectory of documented cases over a 14-day period. For the last 19 days, we have had a steady decline in the growth rate of new COVID-19 cases in Tennessee. The third point is hospital capacity. Here we look at the ability of our hospitals to both treat all patients without crisis care or relying on surge capacity. To date, we've had 775 of our 7,842 COVID patients hospitalized. Through these hospitalizations, we've kept a close watch on the capacity of every one of our hospitals, and they continue to deliver on care without a change in their normal operations. The guidelines also call for an emerging capability to conduct antibody testing. We expect to begin antibody testing in the coming weeks as they become more widely available. I want to talk about some other data points that we're looking at as well. Our state, as you know, has been aggressively testing and identifying new cases of COVID-19 thanks to our private sector partners all across the state and the work of the Unified Command Group. We currently rank 12th in the country for total tests administered and 15th in the nation for tests per 100,000 people. Another key consideration for us has been watching how the virus moves across our state. We watch the average day-over-day increase in growth rate of COVID-19, and what we're looking for is a doubling in the rate of at least 11 days, and we have reached that. So all of these considerations are going into our decision-making process. And while we look at medical data like this, first and foremost, we're also paying really close attention to the economic data in our state. Economic data doesn't drive our decision-making process, but we certainly consider the economic impact that this has had on our people, including the more than 250,000 first-time unemployment claims in our state. Indeed, this economic impact leads to other troubling statistics as well. We have seen an increase in particular types of crime, especially domestic violence. And we've also seen a troubling decrease in the reporting of child abuse. These are effects of a troubled economy, and they're things that we're watching, as well as the medical data, to help drive our decision-making process in this phased reopening of our state. We take all of this together, we're going to open as many things as we can in 89 of our counties next week. And soon after, we hope to see our larger communities in the remaining 6 counties working toward their own safe reopening plan as well. We're going to get Tennesseans back to work as soon as possible. And we're going to continue to beat the drum about social distancing and other safe routines, because while we get Tennesseans back to work, we want to make sure that we keep our people safe and that we keep an eye on all of the critical data points that will allow us to do this in a way that is safe for Tennesseans. Reiterating social distancing and safe routines, I want to remind Tennesseans the most important things that they can be doing, whether they go back to work or whether they're out in public. Those important things do matter, like wearing cloth masks and washing your hands frequently and not going to work if you're sick. And if you feel that you need a test, go out and get a test. Tennesseans have to know that these actions are critical to keep our vulnerable populations safe, especially. Our Unified Command Group has made a tremendous effort to ensure vulnerable populations are protected, especially those in long-term care facilities like nursing homes. Today, Tennessee's COVID-19 Unified Command Group released new data on COVID in the state's long-term care facilities and outlined an action plan on how to prevent further cases and to mitigate existing clusters within these facilities. Starting today, the Department of Health will report the number of confirmed cases and COVID-19 related fatalities in all long-term care facilities across the state. I'd like to ask Dr. Piercy to come up and give further information about this as we work in particular to ensure the safety of our most vulnerable, the elderly, and our efforts to do so in our long-term care facilities. Dr. Piercy.
Thank you, sir. Good afternoon. Before I talk about long-term care facilities, I do want to make one mention of our testing number. Our day-over-day increase did go up by 448 cases from yesterday, but that's important to note that that contains a specific population of high-risk individuals that we talked about yesterday in our prison population. Our day-over-day increase, while it was up, our overall positivity rate still remains at 6.8%, and this does not cause us concern. This was expected and, again, something that we discussed yesterday. Moving into the report on long-term care facilities, we did release both data and an overview today of how we investigate those clusters and what we do to mitigate and prevent that. I want to emphasize that this is not a new plan. This is what we've done all along. We've spelled it out because this is a very high-risk population and some folks that we're really concerned about. But I did want to give you some details into that process. On an ongoing basis, even before any outbreak ever starts, we educate and we provide ongoing preventative measures and guidance to long-term care facilities. When I say that term, not only do I mean nursing homes and skilled nursing facilities, but also assisted living facilities and a facility type that we call residential home for the aged. We actually have over 700 of those in the state that contain or that house over 70,000 residents. So this is a very large population and, again, quite vulnerable. So after we educate, or as we do ongoing education, we focus on surveillance and notification. And that comes through a couple of different mechanisms. One of those is through labs. You know, we get the lab reports, and so we can find out through our contact tracing where that lab has come from. And then earlier in this response, we started requiring any facility with 2 or more cases to report to us. So that's both proactive and reactive surveillance and notification. That's how we first learn about that. The primary step in the entire response is what we consider mitigation, and that involves an infection preventionist as well as contact tracers and epidemiologists calling and going into the facility when appropriate within hours of notification and doing an extensive survey of the facility, of all of the movement patterns and all of the infection control measures in the facility, and as well as guidance on what they can do to cohort patients or put them together so they don't put any additional residents at risk. That process goes on, and it goes on for a long time on a daily basis, usually between the facility and their local health department, but also central office or other experts as needed. That continued guidance is given until the outbreak is considered resolved. What is resolved? That is when 2 full incubation periods have passed and there have been no new outbreaks. Or no new infections. So for COVID-19, that's 28 days. And so that's a long time to go with these nursing homes and other long-term care facilities to make sure that they get the help that they need. The data that we released today is new. The process is not new, but the data is new. And as the governor mentioned, there are 22 facilities in Tennessee that have noted positive cases. There have been a total of 375 confirmed cases statewide and a total of 37 deaths. That's 37 too many. And we want to do everything we can to continue educating and guiding and supporting facilities to not only prevent but also to mitigate this horrible disease when it gets into this vulnerable population. Overall, our primary objective is to care for the patients and make sure they are cared in the safest environment, and we provide all the support that we can. And so through this new release that we put out today, we want to make sure that the public is educated on what that process is, and so facilities know exactly what to expect when they have a case.
Thank you, Dr. Piercy. And we do know that our most vulnerable population is the elderly. And we want to remind folks that that is one of the reasons that each one of us has to continue to be vigilant in our efforts, because that population is counting on us to do that, and we will continue to reiterate the importance. As we reopen and as we move into a new phase of this pandemic, those social distancing practices are a part of the way that we can protect the elderly here in Tennessee. We'll open it up for questions, but I want to remind everyone that we have on hand today Commissioner McCord with the Department of Labor, in case there are any questions about our unemployment efforts here in the state. Commissioner Nichols with Department of Children's Services to address any questions that have come up. I mentioned the troubling lack of reporting for child abuse, so I've asked Commissioner Nichols to be here, and members of our Unified Command Group are here as well, so we're happy to take questions.
Thank you, Governor. First, we'll go to Kim Crucy with the AP. Kim, your line is open.
Hi, Governor. So my question is regarding the data that was released today. I know that this is the first time that we're seeing this publicly, but there are some discrepancies over in Shelby County, for example, over the Parkway Health and Rehab Center, the health department reported one death in that center. That's not showing up on the state website. And granted, that's from today, but over in Gallatin, the mayor has said there were 21 deaths at the Gallatin nursing home. The state data currently says 19. I was wondering if maybe to help shed some light about maybe why some of these numbers may not add up right away.
Thanks, Kim. I'm going to let Dr. Piercy address that question.
You're exactly right. Our data will oftentimes be behind what is reported by facilities or families, because we wait until we have the official death notification through death certificate and confirmation of that death. So it's not only unsurprising, it's actually expected that our numbers will be a little bit behind what you may see reported publicly. And that's important because we're sort of the last source of truth, and that is the documentation of those deaths, and we want to be absolutely certain that we're reporting it accurately, so we do take a little bit more time to do that.
Great, thank you.
Thank you.
Next, we'll go to Chris Davis with News Channel 5. Chris, your line is open.
Dr. Piercy, continuing on with the discussion about the nursing home numbers, why are you only releasing long-term facility names if they have at least 2 cases? Isn't one case notable as well?
One case is notable, and we absolutely investigate those and know about all of those. The definition of cluster is 2 or more, and so that's why we note clusters in those facilities.
Thank you.
Next, we'll go to Alex Apple with Fox 17. Alex, your line is open.
Governor, my first question for you is you cited, and I want to say it correctly, it was on one of your slides as well, that there's been a downward trajectory in documented cases over, I think, 19 days, but the number of new cases has fluctuated. How are you getting that rate stat, or how is that calculated?
Yeah, I'll let Dr. Piercy address that specifically, but if you look at the trend of that number over the last 18 days, while it fluctuates, it has a downward movement over that extended period of time, and that's what we're looking for. We're looking for a downward movement of cases over that period. Do you have anything to add to that?
I won't rehash all of the math technical terms that I got into yesterday. I'll try to simplify it more today for you. So what we look at is a downward trajectory in the growth rate. And a lot of the confusion, I think, has come from the either or criteria in the White House guidelines for opening up America again. And it talks about a decreased number of cases or a decreased growth rate, a downward trajectory over time if your test number is increasing. And so that's why it's important to look at the percent growth day over day. And so the 19 days ago is when we first started seeing that come down into single digits. It started out at the 8 to 9 mark, and now, except for today because of the special circumstance that I noted, for the last 2 days, it's been in the low 2% range. We went through a little exercise just earlier today looking at the groupings of those numbers. And if you group those numbers, you have about an average of 7, and then about an average of 5, and then about an average of 3. So any way you slice or dice it, there's a downward trajectory.
And Doctor, may I ask, did you have a problem processing test results at all at labs this weekend, or did you have some extra capacity as they started to do more tests?
That's a great question because we absolutely have to maximize our lab capacity, and our private sector partners have stepped up to the plate. And that's one of the reasons we have done such a good job in Tennessee with some of our turnaround times. They're not always perfect, but we have so many good private sector lab partners across the state. And we've called on almost all of them to say, hey, we need you to ramp up because you're about to get a flood of tests. And that's exactly what we've given them over the last 3 or 4 days. And quite frankly, we're continuing to do that day over day and expect another big surge this coming weekend.
Next, we'll go to Sam Stockard with the Daily Memphian. Sam, your line is open.
Yes, thanks, Governor. Appreciate your time. You told the legislators this morning you felt like the state's efforts have saved thousands of lives. Some physicians and several legislative Democrats say opening too soon will cost lives. And then several Memphis Democrats have also said that people are going to be confused by the state's April 30 or May 1st opening, and then I believe Memphis has a May 5th reopening of businesses. How do you respond to those?
Yeah, spoke with the Memphis mayor yesterday and have been weekly and more frequently than that talking to leaders of our major metropolitan areas. The way that we will make sure Tennesseans are safe is by doing all of the things that we're talking about doing, following data, making sure that we develop guidelines for businesses to open, because as businesses open up, they will not be opening up in the same way that they did before. They'll be incorporating social distancing. That's how we prevented the rapid spread of this virus in the state. And that's why if we do a phased reopening that includes social distancing in every component of that opening, then we will continue to keep our citizens safe and continue to mitigate the spread of the virus. But with regard to Memphis versus the other 89 counties, or the 6 counties versus the other 89, there's been a great effort to work together. We have developed guidelines for those counties for which the State Department has jurisdiction over the health department there. The state has jurisdiction over the health department, but for all other counties, we're working to develop a strategy and a plan as well. Those individual counties will be doing so, and we believe they'll have a safe reopening plan to go along with the one that we've developed in the state.
But do you feel like people will be confused by the different time frames?
Well, I think if you live in Memphis, that it'll be clear that that is the time frame for Memphis. And if you live in one of the counties for which our time frame is laid out, it should be clear to you that that is the time frame that will be applicable to residents of that county. We are working together. Let me just say that. There is a real effort across this state. We make calls to county mayors, to municipal leaders, to city mayors, to all of the mayors in both the counties and cities in those 6 biggest counties. We've stayed in continuous contact and are working together to make sure that we have a coordinated plan that incorporates safety as we open up our economy here in Tennessee. And I'm encouraged by the way that our leaders all across this state have worked together.
Next, we'll go to Stephen Elliott with the Nashville Post. Stephen, your line is open.
Hey, just checking that you can hear me.
Yep.
Thanks. Metro Nashville officials identified a cluster of new cases around Antioch that they said was tied to the disproportionately immigrant population there continuing to work on the front lines. Has the state identified similar clusters elsewhere?
You want to address that?
Yes, we actually have a cluster summary that we look at every day. It's a dashboard of all the known clusters in the state. I know we've talked some today about clusters in long-term care facilities, but we're looking at them everywhere. A lot of those are in workplaces where people are working in close quarters because they have to get the job done. Some of them are in religious organizations where people gathered together. Some of them are just in geographic communities where people are living in very close quarters as well. We have identified several clusters in various ethnic communities, and there are different reasons for that, but we are working with them in very culturally sensitive ways to help mitigate any of the issues that they may be having. Specifically, what you're referencing in Antioch is under the Nashville-Davidson County jurisdiction, and so the state is not necessarily intimately involved in that, although in many, if not all, of the major clusters in a metro area, the state does provide assistance and support.
Next, we'll go to Natalie Allison with the Tennessean. Natalie, your line is open.
Hello, Governor.
Hey, Natalie.
The Tennessean's question today is about the Tyson plant in Goodlettsville, where as of last week, there were at least 90 employees who had tested positive for coronavirus. Today, their parking lot is full, and it appears that they're still operating at their usual level. And elsewhere in the country, there have been meatpacking plants who are temporarily shutting down for even fewer cases. So can you all speak, A, to consumers about whether products at this plant or coming from this plant are safe, and B, whether the state has a role in this type of case, as it's done in places like long-term care facilities, to step in, order them to pause operations and disinfect, things like that?
Sure, absolutely. And in fact, when I answered the last question, I did have that cluster in mind as well. So it's an interesting phenomenon that we're seeing all across the nation, which is these outbreaks in meatpacking plants and in other areas where assembly line workers may be in very close proximity. If you've ever been in some of these plants, you know, particularly when they're carving meat, they're carving a very specific section of that, and they stand almost shoulder to shoulder. Makes it very difficult to contain infections when that happens. The Tyson plant specifically also is under the Nashville jurisdiction, and we have provided some assistance there. We've been very pleased with their response. They have done a good job at decontaminating and making infection control measures amongst the workers that are there. And I want to reassure you and the public that that does not pose a food safety concern. This is not something that is transmitted in food, and I'm pretty sure you're familiar that we're pretty quick to pull the trigger when we think there is a food safety issue, whether it be lettuce or any type of meat in certain kind of outbreaks. But this is not a virus that's transmitted in food, so you can rest safely in that.
Kirsty, are there any other food plants or other factories in the state where you all are aware of clusters of cases?
I am aware of another meatpacking plant that is a Tyson facility in the state. I can't think of any other major ones off the top of my head. I know that our friends in North Carolina and in other surrounding states have had significant issues in not only food production but also livestock facilities. And so we encourage you or encourage these folks to look at industry guidance from not only from the CDC, but as our economic recovery group starts to issue industry-specific guidance, to rely on that to control and mitigate the infections there.
And about how many cases are at that other Tyson plant, and where is that plant?
I know it's in Shelbyville, but I do not recall the number off the top of my head. I'm sorry.
Next, we'll go to Hannah Walsmith with WMC Memphis. Hannah, your line is open.
Good afternoon, Governor. Some Tennesseans may think it's still too risky to go back to work. So if an employee refuses to go to work when the state reopens, can they still collect unemployment?
You know, I want to let Dr. McCord, who is our Commissioner of Labor and Workforce, speak to that and other issues around our unemployment here in the state in this unique time. Dr. McCord?
That is a great question, and we're navigating that too with federal guidance, because right now we have federal guidance that tells us that yes, that job refusal, if somebody is afraid to go to work, they can still collect the unemployment benefits as they go up, at least the federal piece. So that is something that we're navigating during this transition time, and we'll have more information as we get more guidance.
And I had a follow-up question. A lot of rural county residents work in cities like Memphis and Shelby County. Some of them work essential jobs. Is there any concern that they could bring back the virus back to those rural communities that they live in after you just open them back up?
You know, what we really believe is that if Tennesseans continue to practice social distancing, and if they are in a workplace that is providing a safe environment for their workers, which is what the work of the Economic Recovery Group, the work this week for that, to provide that guidance for those businesses that are going to open up. That's how we create an economy that people can go to work in, but go to work in safely, and to continue to mitigate the spread of this virus. That's what the goal is, and we believe that's what's going to happen in the weeks ahead.
Next, we'll go to Grace King with WBIR. Grace, your line is open.
Hey, good afternoon, Governor. The latest data available shows you've made payments to a little more than half the unemployment claims filed since the pandemic, and I know not all of them will be approved, but what's your message to the other 150,000 Tennesseans still waiting? When is help coming for them?
And so as of today, so far this week, we've made over 210,000 payments to the uninsured who are in our traditional uninsured employment system, the TUC. That includes the additional $600 from the federal government, and it includes the back pay from March 29th when they first were unemployed. So I think the number is a little higher than that, the percentage is, but 210, we fully expect to be at 250,000 before the end of the week, and the pay cycle is Sunday through Saturday. And so we're working towards that. On the other side, of the equation are the extension of benefits to the 1099 folks for the sole proprietors, and we've built that system. It's in testing right now, and relief for them should be coming in the soon in the coming days.
And as far as soon, I mean, what should they be doing to make ends meet right now?
Well, we are looking here in the next few business days to get those payments out. And it's a struggle. We know it's a struggle every day. That when we go to work, we understand that, and we understand the weight of it and the importance of it. And rest assured that we are working to do that. This, I think, to go into the complexity of this, this is a whole nother system that didn't exist before, and so we've had to build it. Unlike the unemployment insurance system that typically would cover you, that's been built over decades, we've had to build this in a few weeks. And so I would tell them help is coming, and help is coming soon.
And I also want to just add to that we certainly know and understand, and we've said that Tennesseans have made tremendous sacrifice in this, and some of the hardest hit are those that you're talking about that are currently unemployed. And while we're making every effort we can to adapt to an incredible surge in the demands on the systems for unemployment insurance, we're also working really hard to get Tennesseans back to work. That is one of the reasons that we are working so hard in the different avenues that we've discussed today. It's why it's so important that when people go back into the workforce, that we do so in a safe way so that we can continue to keep our economy moving forward. The reason we want to do a phased reopening of our economy is because we believe that we're in the right place from a medical standpoint, but we're in a very important place to be able to bring Tennesseans back to work, to get folks back to receiving a paycheck instead of an unemployment benefit, and that's what we hope to be doing in the weeks ahead.
Next, we'll go to David Floyd with the Johnson City Press. David, your line is open.
Hey, Governor. I had a question about something that you guys talked about during the stimulus accountability meeting this morning. You had talked about how one of the biggest challenges for the state coming up is a shortfall in revenue stemming from COVID-19. Does the state have the capacity currently to plug that gap on its own, or will it have to rely on aid from the federal government to do so?
Well, our state's in an unusual place because of the work of the legislature over the past several years and leadership that has created a stable economic situation for our state. So we have significant revenues. We have significant resources in our unemployment trust fund, for example, and our TANF fund reserves. We have a rainy day fund balance that is significant. And all of those things have been done to prepare for a difficult economic time. Now, the extent of the damage to our revenues is unknown. We're only a few weeks into this, and there's no real data that shows just how hard this economy and the downturn of this economy will affect our state's budget. We're encouraged by the work that we've done to prepare for this in advance, but it's really difficult to know what's going to happen in the next year or year and a half. Much depends on what happens with this virus over the next year and how quickly it's mitigated, either through a cure or through a vaccine. But we are beginning to prepare for and work. Certainly, we know that there will be a real strain on the state's budget because of the downturn in revenues, and we're trying to collect data right now that will give us some indication of what that might look like and what our capacity to meet those shortfalls is with the current reserves that we have in place.
Thank you.
Mm-hmm.
That's all the time we have for questions today, Governor, if you would like to make a closing statement.
Thank you for being here again. Thank you for joining us for this briefing. Be encouraged, Tennesseans. We're making great progress. And we're making great progress in spite of the fact that we have a great challenge and a great pandemic that we're in the middle of. We're making great progress because of what you're doing. So keep it up. Together, we can continue to mitigate the spread of this virus. Together, we can open up our economy. Together, we can keep our citizens safe in the weeks and months ahead if together we do our part to stay apart. Thank you very much.